But first, one of the busiest travel weeks of the year is just a few days away, and officials at Pearson Airport have some tips for passengers heading out for March break.
So we have YYZ Express, so you can book your spot on the security line before you get to the airport, so you can use a special line. For passengers who are heading to the States, you can use mobile passport control, so you can fill out your information before you come to the airport, use a separate line as well. We've also made things like wait time dashboards accessible on our website, so if you're on your way to the airport, you can see, for example, exactly how long the security lines are going to be.
Up to 140,000 people are expected to pass through the airport per day during the peak of March break. Pearson officials say that's up nearly 10% since last year. And as families prepare to take off, there is concern over what the busy travel week could mean for measles cases in Ontario. Erica Natividad with the updated numbers and the push for vaccination.
So this is a person who we don't know where they got measles from, visited a few healthcare sites, one restaurant in Peel, and is a teacher in a school, and therefore there was an exposure in a school.
York Region's Medical Officer of Health providing an update Tuesday on the latest measles case in Ontario. A fully vaccinated teacher in his 30s with no recent travel history. Last week, the over 1,500 students and 150 staff members at the teacher's high school were notified of the exposure. A vaccine clinic was held over the weekend.
We've been following up, 24 hours a day for the past 5 days. And in fact, over 98% of students at that school are vaccinated for measles and have continued to attend school.
Even as this case did not involve travel, the upcoming March break is raising concern among health professionals. Measles was eliminated in Canada in 1998 due to vaccination. However, York Region's Public Health Agency states that there continue to be sporadic cases, especially as people travel to other parts of the world. It highlights the current outbreak in Europe, with over 40,000 cases, including many who are seriously ill. Public Health Ontario has so far confirmed 5 cases of measles in the province. Toronto's only case was linked to travel, an infant who had to be hospitalized in February.
We know that it can spread so quickly, and it finds those pockets of people who are not vaccinated.
Toronto Public Health is urging residents to check their vaccination status ahead of March break, noting that vaccination rates among young people post-pandemic are likely lower than usual.
We haven't been able to actually focus our resources to monitor vaccine coverage. But we also know there have been challenges for those families to have their kids vaccinated.
5 confirmed cases of the measles in Ontario. Why is this a big deal?
The issue here is if we do, or I guess more accurately, when we do see imported cases, we should have high enough vaccine rates such that we prevent onward transmission within the country.
So how do you know if you've been vaccinated against the measles? Well, you can check that little yellow vaccination card if you still have it, or you can check with your primary care provider or your local public health unit. Another thing to note is the vaccine does usually take about 2 weeks to take effect. However, health professionals are urging unvaccinated people who are traveling for March break to still get that first dose. In Toronto, Erica Natividad, City News.